How to manage suspected spinal injuries on the field. When it comes to rugby, safety is a top priority, especially regarding suspected spinal injuries. So, how do you manage these situations effectively on the field? Let's break it down step by step. First, it is essential to recognize the mechanism of injury. If a player has fallen or been tackled in a way that could affect their spine, immediate action is needed. The first step is to initiate manual inline stabilization of the player's head and neck. This means holding their head firmly in a neutral position to prevent any movement that could worsen the injury. If the head is not in a neutral position, gently move it there unless it causes pain or other concerning symptoms. Next, conduct a careful assessment without moving the player unnecessarily. Check for spinal pain, any radiation of pain, and neurological symptoms like numbness or weakness in the limbs. Inspect the spine for bruising, swelling, or tenderness. If it is safe, ask the player to slowly move their head left and right or flex and extend their neck. Stop immediately if they experience pain or any unusual symptoms. If there are signs indicating a spinal injury, full spinal immobilization is required. This involves securing the player on a spinal board or stretcher. Use appropriate head blocks and straps to restrict all spinal movement before transporting the player to a hospital. During this time, it is also important to administer oxygen through a non-rebreather mask to support their breathing. Removing protective gear, such as helmets and shoulder pads, should only be done by trained personnel. This should only happen if it is necessary to secure the airway or perform resuscitation. Improper removal can lead to dangerous spinal movement. On-field management is most effective when medical staff is well prepared and trained. Having a clear team leader coordinating the response can make a significant difference. Pre-game planning and rehearsed protocols improve the speed and safety of care. To summarize, managing suspected spinal injuries on the rugby field involves immediate manual inline stabilization, careful assessment for pain and neurological symptoms, full spinal immobilization if necessary, administering oxygen, and ensuring a coordinated medical team response. These steps help minimize the risk of worsening the injury and improve the player's chances of recovery.